In conclusion, our study suggests that vitamin D3 supplementation during the winter season may reduce the incidence of influenza A. This effect was prominent in specific subgroups of school children. Moreover, asthma attacks were also prevented by vitamin D3 supplementation. Hey everyone, thanks for tuning in. Today I've got 2 new studies for you on the efficacy of vitamin D with regard to influenza. But before I start, you guys know the drill. Like the video, subscribe to the channel, hit the notification bell, ding ding ding. And if you don't want to watch the entire video, I will be including timestamps in the description so you can skip ahead to the section that you want. Now onto the topic at hand. Last week I had mentioned that every week for the next few months, I am going to be sharing with you 2 scientific studies on the efficacy of vitamin D with regard to influenza. And today I have 2 new studies for you, and the first one comes from the Journal of Pharmacology and Pharmacotherapeutics, and it is called Vitamin D for Prevention of Respiratory Tract Infections, a Systematic Review and Meta-Analysis, and it was published between October to December of 2012. Now, what exactly was the purpose of the study? Well, the purpose was to explore the effect of vitamin D supplementation in prevention of respiratory tract infections on the basis of published clinical trials. And the authors noted in this study that recent research suggested that vitamin D also has a potential role in the prevention of ARI. ARI is acute respiratory infection, by increasing immunity. In some observational studies, it was observed that low vitamin D levels in blood is associated with the increased incidence of respiratory tract infections. There is a need to refine our knowledge about the functions of vitamin D in the prevention of respiratory tract infections in light of clinical trials which were done to explore this phenomenon. Hence, we conducted this systematic review and meta-analysis to assess the role of vitamin D supplementation in prevention of ARI, or acute respiratory infections. Now, how exactly did they do this? We know it's a meta-analysis, so what studies were included and how many studies were included? Well, clinical trials were searched from various electronic databases, and 5 clinical trials were suitable for inclusion. Outcome was events of respiratory tract infections in vitamin D group and placebo group. Data was reported as odds ratio with 95% confidence interval. Both random and fixed model was used for analysis. Analysis was done with the help of comprehensive meta-analysis software too. And in terms of the inclusion and exclusion criteria for this particular meta-analysis, only randomized placebo-controlled clinical trials exploring the effect of vitamin D supplementation on prevention of respiratory tract infections like influenza, pneumonia, and the common cold were included in the analysis. Only those clinical trials where results were given in categorical variables were included. Non-randomized clinical trials without controls and clinical trials showing results in continuous variables were not included. Clinical trials in which vitamin D was used in combination with other intervention or interventions were not included in the final analysis. Process of selection of various RCTs for this study is given in the form of preferred reporting items for systematic review and meta-analysis chart according to PRISMA statement. And with regard to the results, what they found was on the basis of inclusion and exclusion criteria, we found 5 clinical trials. Dose of vitamin D used in these clinical trials were ranged from 400 IU per day to 2000 IU per day. In one clinical trial, single parenteral dose of vitamin D was given at 100,000 IU, and that was in Table 1. I'm going to go to Table 1 right now really quick. Table 1 shows the characteristics of clinical trials included in the meta-analysis. On the left-hand side, we have the 5 different studies that were selected. Then there is the dose, the duration, and the population. So in the first study, it was in 2010, and the dose was 400 IU per day. The duration was 6 months, and it was performed on 18 to 28-year-old men. The second one came from 2010. This one had a dose of 1200 IU per day. It was performed over the course of 4 months, and it was performed on 6 to 15-year-old children. The third study was performed in 2009, and it was also given a 1200 IU a day dose. It was performed for 3 months, and it was on 18 to 80-year-old adults. The fourth one was performed in 2010. This was the one where they gave them 1 dose of 100,000 IU over the course of 3 months, and it was performed on 1 to 3-year-old children. And then the fifth and final study was performed in 2007, and it was given a dose of 2,000 IU per day over the course of 3 years, and it was on postmenopausal women. Now, let's go back to the actual results. In 4 clinical trials, events were recorded in the form of number of participants suffered from respiratory tract infections during the trial period. In one clinical trial, events were recorded in the form of total number of times participants reported respiratory tract infection in the questionnaire given to them, 4 times in the trial period. Levels of evidence of these clinical trials were high or moderate. Level of evidence was assessed according to the Grades of Recommendation, Assessment, Development, and Evaluation Working Group, or GRADE Working Group, and information related to the quality of evidence and biases in this clinical trials are mentioned in Table 2. So what exactly were the results in terms of vitamin D relative to the placebo group? Well, overall events of respiratory tract infection in vitamin D group were 21.7%, or 205 out of the 943 participants, whereas in placebo group, it was 30.1%, or 279 out of the 925 participants. So basically, in the placebo group, the rate of respiratory tract infection was almost 50% higher than in the vitamin D group. There were 2 clinical trials which were dealing with pediatric age group. These clinical trials were analyzed separately, and it was observed that in this age group, also vitamin D supplementation reduces the rate of respiratory tract infections significantly. And then lastly, 3 clinical trials were dealing with adult population. In these clinical trials, odd ratio was in favor of vitamin D group, but it was not significant. However, after analyzing on the basis of fixed model, values were significantly in favor of vitamin D. This systematic review and meta-analysis was done to explore the role of vitamin D supplementation in prevention of respiratory tract infections. According to this systematic review and meta-analysis, vitamin D significantly reduces the respiratory tract infection related events as compared to placebo. Beneficial effect of vitamin D was observed in children as well as adults according to the fixed model. Beneficial effect of vitamin D was observed only in children according to random model. This assessment is based on only 5 clinical trials, as less clinical trials are done for the exploration of the same. Various reasons are given for the protective action of vitamin D in prevention of respiratory tract infections. It is believed that vitamin D increases the production of natural antibodies. Vitamin D is also known to strengthen the immunity by inducing monocyte differentiation and inhibiting lymphocyte proliferation. It also postulated that vitamin D enhances the phagocytic activity of macrophages. And in terms of what the authors concluded that on the basis of this study, we can conclude that vitamin D is useful in prevention of respiratory tract infections, but looking at the availability of only 5 clinical trials, there is need of conduction of more clinical trials so that more valid conclusions can be reached. That was pretty much it for the first study. Now, the second study, this one over here, it comes from the American Journal of Clinical Nutrition. It was published in 2010, and it is called Randomized Trial of Vitamin D Supplementation to Prevent Seasonal Influenza A in School Children. And the purpose of this study and how exactly it was designed was they investigated the effect of vitamin D supplements on the incidence of seasonal influenza A in school children. And in terms of the design, from December 2008 through March 2009, they conducted a randomized double-blind placebo-controlled trial comparing vitamin D3 supplements of 1200 IU per day with placebo in school children. The primary outcome was the incidence of influenza A diagnosed with influenza antigen testing with a nasopharyngeal swab specimen. And in terms of the actual study population, the school children were aged 6 to 15 years of age with or without underlying diseases, and they were eligible and asked to participate in the study by the pediatricians in charge of the outpatient clinics. The accrual period was from the 1st of November 2008 to the 15th of December 2008. Participants were asked to start taking the study drugs between the 1st and 15th of December 2008 and to continue taking the medicine until the 31st of March 2009. Children were excluded if they 1. Had a history of stones in the urinary tract or diseases of calcium or bone metabolism, 2. If they were already taking vitamin D3 or activated vitamin D as a treatment of an underlying disease, 3. Had a history of allergic reaction to ingredients in the tablets, 4. Had difficulty swallowing tablets, 5. Had been receiving immunosuppressive therapy, including oral corticosteroids or chemotherapy within the past year, and 6. Were considered incapable of taking part in the study by the pediatrician in charge. Parents and children were asked to provide written informed consent after the pediatrician explained the study to them at the outpatient clinic. And in terms of how exactly they went about randomizing the study, what they did was they used a central computerized procedure to randomly assign children in permutated blocks of 4 to receive either vitamin D3 or a placebo. Parents were provided with 8 numbered bottles, each of which contained 90 tablets. 1 tablet contained 200 IU of vitamin D3 or placebo, and the active and placebo tablets were identical in appearance. The participants were asked to take 3 tablets twice daily, totaling 1200 IU per day of vitamin D3 or a placebo, and the blinding of the study was achieved by bottle labeling. The randomization code was disclosed to the staff at the data monitoring center after labeling the number on each bottle. Staff at the data monitoring center had no contact with the patients. And in terms of the actual characteristics of the study population, there was a total of 430 school children / parent pairs who met the inclusion criteria and agreed to participate in the study and were randomly assigned to treatment. The age, sex, weight, height, number in the family, number of siblings, starting age of nursery school, skin reaction to sun exposure, and underlying diseases including medical history from age 3 years of age of atopic dermatitis, otitis media, sinusitis, and asthma based on questionnaires were similar between the two groups. The mean age of the study population was 10.2 years of age, 56% were male, the mean family size was 4.5 persons, 23% had no siblings, and 65% started nursery school or kindergarten at 3 years of age or older. A total of 27% had underlying diseases and 26% had bronchial asthma, all of which were diagnosed by pediatricians. A total of 56% and 23% of participants had a history of asthma and atopic dermatitis, respectively, after the age of 3 years. There were no significant differences in baseline characteristics between the two groups as assessed by chi-square tests and Wilcoxon's rank sum test. And now in terms of the adherence, a lot of times what happens with these studies is a lot of people will drop off. So they actually measured the adherence in the study, and what they found was of the 430 children, 334 were followed until the end of the study. Loss to follow-up occurred for 50 children in the vitamin D3 group and 46 in the placebo group. Compliance with taking vitamin D or placebo twice daily was evaluated on the basis of logs provided, which showed that 96% took the drug as directed. Compliance patterns did not differ significantly between the two groups. Children who were already taking vitamin D3 or activated vitamin D as a treatment of underlying diseases were excluded before randomization. However, some participants started taking vitamin D supplements in addition to the study supplements after randomization because this was not prohibited. And in terms of what exactly they found in terms of the outcomes, influenza A occurred in 49 children. The first case occurred on the 15th of December 2008. The incidence of influenza A peaked from the middle to late weeks of January. Influenza A occurred in 18 of the 167 or 10.8% of the children receiving the vitamin D3, compared with 31 of the 167 or 18.6% of the children receiving a placebo. So there was almost a 90% increase in the rate of influenza from the placebo group relative to the vitamin D3 group. And what they found was we compared the incidence of influenza A based on the timing of onset of disease symptoms relative to the initiation of vitamin D intake after supplementation started. Between day 1 and day 30, the occurrence of influenza A was not significantly different between the vitamin D3 group, where 2 out of 167 people got it, and the placebo group, where 4 out of 167 people got influenza. Between day 31 and day 60, influenza A occurred significantly less often in the vitamin D3 group, with 9 out of 167 kids getting it, than in the placebo group, where 22 out of the 167 kids ended up getting influenza. And between days 61 and the end of the study, the occurrence of influenza A was not significantly different between the vitamin D3 group, where 7 out of 167 of the school children got it, and the placebo group, where 5 out of the 167 school children got it. So basically, the first month and the last month, there wasn't a huge change in the development of influenza between the placebo group and D3, but in the middle month, days 31 to 60, there was almost a 90% increase in the rate of influenza with the placebo group relative to the vitamin D3 group. So with regard to the dosing of vitamin D, what exactly did the authors think? Well, in this randomized clinical trial, daily supplementation with 1200 IU of vitamin D3 in school children between December and March showed a significant preventative effect against influenza A. Although no significant difference was observed for influenza B, a 10-day course of post-exposure prophylaxis with zanamivir or oseltamivir resulted in only an 8% decrease in the incidence of symptomatic influenza in children. In contrast, daily dietary probiotic supplementation was a safe, effective way to reduce fever and other symptoms in small children. Moreover, a significant preventative effect of a product containing echinacea, propolis, and vitamin C on the incidence of respiratory tract infections was observed in children. And because taking vitamin D3 supplements for 1 year with a dose ranging from 200 to 2000 IU in school children has been shown to be safe, we set the dose of vitamin D3 at 1200 IU in this trial. No serious adverse events occurred. It reportedly takes approximately 3 months to reach a steady state of vitamin D concentrations by supplementation. Thus, December might be theoretically too late to start supplementation. However, in this study, vitamin D3 significantly reduced the incidence of influenza A within 60 days. So basically what they found was that vitamin D was very, very effective. However, it does take approximately 3 months for your body to build up enough vitamin D stores in your body for it to be effective. So if you do plan on taking vitamin D3 as a preventative measure for influenza, you don't want to start it right when flu season is starting. Rather, you would want to get a jump start on it because it is going to take a few months for it to build up in your system. And the authors concluded that, in conclusion, our study suggests that vitamin D3 supplementation during the winter season may reduce the incidence of influenza A. This effect was prominent in specific subgroups of school children. Moreover, asthma attacks were also prevented by vitamin D3 supplementation. This is something that I didn't really cover in the video, but this was something that I came across when I was looking at this article, and the decrease in the events of asthma was actually pretty significant with regard to the vitamin D3 versus the placebo. So if you do have issues with asthma, not only will supplementing with vitamin D3 help at reducing symptomology when it comes to influenza, but it will also greatly improve your symptoms when it comes to asthma. Again, though, you can still take vitamin D3, you can still get the flu, you can still develop asthma, but what this study shows is that if you do supplement with vitamin D3, it is greatly going to reduce the chances of you suffering any adverse effects from influenza or asthma. But that's pretty much it for today's video. If you enjoyed the video, be sure to smash that like button so I know to make more of these types of videos in the future. And if you're either new to the channel or haven't subscribed yet, be sure to subscribe to the channel and hit the notification bell, as I will be uploading new videos every single day. That's it for today's video. Thanks for tuning in, and I will see you again tomorrow.